Hello, my name is Keela Leach, and today we will take a look at the evidence-based research program Not on Tobacco. Trends in U.S. teen smoking are on the decline according to data from the Centers for Disease Control. Rates have decreased by more than 50% from the year 2013 to 2016. If we look at trends from just 2016, we can see that tobacco use among middle school and high school students remain common. The overall numbers here show that high school students smoke more than middle school students and males smoke more than females. A survey of adult smokers found that the vast majority of them reported becoming regular smokers as adolescents. In addition, chronic smoking-related illnesses are typically not seen until later in life, and therefore it is crucial to continue efforts to decrease tobacco use among youth. Factors that determine the likelihood of tobacco use are numerous. I will discuss these 5. As already discussed, the current statistics in the U.S. indicate that males are more likely to smoke than females. One evaluation of the NOT program found that geography may play a role in an increased tendency to smoke. The West Virginia students who participated in the NOT program were followed up 15 months later. This follow-up found that while there was a measure of success in quit rates among the youth in West Virginia, consistently higher success rates were observed in urban regions where students participated in the same program. Some literature point to higher smoking rates among youth and adults in lower socioeconomic groups. The socioeconomic status is also closely linked to lower education levels and the higher likelihood of tobacco use. Conversely, the higher the level of education, the lower the rate of smoking. Young people who do not perceive a great health risk in smoking are also more likely to use tobacco. Recent media campaigns targeted at youth exposing the health risks that have been attributed to a decline in smoking among the youth. Environment can encompass many factors, including social norms, like peers and parents who smoke, locations where tobacco is a large part of the economy, where tobacco is grown, for example, and media targeted at youth that make smoking seem to be the norm. All of these environmental factors may contribute to the likelihood of some sort of tobacco use among adolescents. Key stakeholders in the NOT program included the West Virginia Prevention Research Center, the American Lung Association, the state's Department of Education, the Public Health Department, and of course the students who volunteered to participate. Because West Virginia had the most astounding rate of smoking in the nation in the mid to late 1990s, the West Virginia Prevention Research Center scientists teamed up with the American Lung Association, the state's Department of Health, and Public Health Department to address this health topic. These key stakeholders developed the NOT curriculum. The American Lung Association provided training for the individuals who would conduct the succession program at respective sites, as well as a portion of the funding. Students who volunteered were enrolled after meeting a specific criteria. The external stakeholders varied, one of which was the CDC, which provided financial support. School overseers and educators were incorporated into distinctive parts of the program. The program also incorporated different partners to design, actualize, assess, and disperse intercessions. The study was duplicated in North Carolina among a tribe of American Indians. The University of North Carolina Prevention Research Center collaborated with researchers from West Virginia and various organizations and community leaders with a personal stake in the well-being of the American Indians. This team spread the message of the initiative by way of phone calls, visits, and other community networks. The message gained further credibility through the involvement of community religious organizations and other powerful families within the community. The program was financed with grants from the CDC, the American Legacy Foundation, and other small grants. Public health routinely intersects with politics and ethics. The science of public health may often get lost depending on the political landscape at any given time. Allotment of funds for public health policies are done legislatively. However, politicians may have motivations other than those of the public health agenda. Some of the most controversial topics in public health today include the needle exchange program for drug users, gun control, on women's right to choose, and tobacco control. While scientific data indicate that the needle exchange programs are successful in reducing the spread of infection, opponents, to include politicians, believe that to do so would be giving license to the use of illicit drugs. Gun violence takes a toll on the public health of our society in many ways, including psychological problems and the impact of costly medical interventions. However, the CDC research on gun violence has all but ceased based on considerable pressure from gun lobbyists and politicians in allegiance to them. The topic of family planning has been debated for decades. Public health professionals consider that family planning is essential to the health of the mothers and babies. However, fierce moral, religious, and political views equate family planning with abortion. Those who oppose tobacco control will argue that smoking is an issue of individual liberty, and that these individuals voluntarily assume the risk associated with smoking. Programs like KNOT could be faced with decreased financial resources based on individuals with a libertarian social and political views. Tobacco control campaigns that can also create a perceived humiliation. Smokers that often experience unsuccessful efforts at cessation because they try to stop smoking unassisted. The KNOT program was implemented on a voluntary basis, and also the literature described an environment of a high level of facilitator and peer support. The KNOT program includes other ethical considerations. It aids in reducing chronic illnesses and fatalities related to smoking. It also addresses the important issue of social justice. This involves the belief that the harms from smoking do not occur equally in our society. The health disparities and efforts such as taxation have a disproportionate effect on the disadvantaged. In summary, we talked about the determinants of health. We examined the research conducted by the KNOT program across the Appalachia regions of West Virginia and North Carolina. This program assessed situational, environmental, and age-related factors that influence teen smoking and the rate of cessation. The program targeted teens between the ages of 14 and 19 and attending school. The research included both males and females. They looked at other key indicators for smoking, such as geography, countryside versus urban areas, and socioeconomic status. Infrastructure is the support system that enables the functions of public health to operate efficiently. Scientists and researchers at West Virginia University and the West Virginia Public Health Agency were among the primary stakeholders for this program development. The program engaged members of the community to facilitate implementation. The members included teachers, other school employees, and students as advisors and voluntary participants. Funding resources were provided by the American Lung Association and the CDC. We can see positive outcomes in public policy from endeavors of research such as the described in the KNOT program. Current trends in smoke-free public areas, increased taxes on tobacco products, and age limitations for access to tobacco are all a result of endeavors like those described in the KNOT research program. The social justice point of view bolsters the case for tobacco control. At the same time, it acknowledges huge burdens may be placed on those that would benefit most from these arrangements. While smoking and smoking-related conditions have a disproportionate effect on those with a lower socioeconomic status, it is these individuals who feel the burden of increased prices for cigarettes. It may seem logical for the individual to alter their behavior. However, the addiction may override the desire to quit. This emphasizes the importance of cessation programs like KNOT, particularly as this was an effort to change health behavior among youth. On the other hand, those with a libertarian perspective, policies that reinforce tobacco control are taking away their freedom of choice. The coordinated efforts of the researchers, public health professionals, and health organizations and external stakeholders were key to the development and implementation of KNOT. Results of KNOT reinforced that those in charge of teaching and watching over the health of society can continue to actualize and expand similar projects and approaches that have proven to be effective.